Before we start to take the pulse, we need to consider several things. An important one is comfort, both the patient's and your own, so seating is important. Because we usually start off taking the pulse on both wrists simultaneously, to do this we sit opposite each other. In class we use a table, which is actually preferable, but in clinic it may be more practical to use a pillow on the patient's lap instead. Both of you need to be as relaxed as possible. The patient needs to be sitting fairly upright so that their chest and therefore their heart and their lungs are not being compressed. Another important aspect is arranging the patient's arms so that the position is comfortable for them and both wrists are accessible to you. You may need to ask the patient to remove jewellery or a watch.
Okay, would it be okay to just roll your sleeves up for me and just take the bracelets off? That'd be great. Thank you. Okay, I'm just going to arrange your arms like this. Does that feel comfortable?
Yeah, that's
yeah.
fine.
Okay.
Different patients and different practitioners find different ways of arranging the arms that are comfortable and allow access to the patient's wrists. The next important aspect is finding the pulse. We use the radial artery, which comes down from the base of the thumb. Take a look at the width of the patient's fingers. This will indicate the space that your fingers should take up on the patient's wrists. Feel for the edge of the scaphoid bone and place your first 3 fingers in the same space as the patient's fingers would occupy if their own fingers were on their pulse. If the patient has bigger fingers than yours, space your fingers out accordingly, and if they have smaller fingers, put your fingers closer together. Because we apply pressure to the artery to take the pulse, we need to be able to control how we do that. There are 2 common ways to do this. One is to support the patient's wrist using your thumb on the back of the patient's hand. The other is to rest your hand on the surface of the table or pillow and use the heel of your hand to apply the opposing pressure. We're probably in the right place now, but have to find the artery. So we press a little bit and explore the space between the bone and the tendon in that area, palpating laterally and medially to find the pulse. Having found some sense of the pulse and identified where it's strongest, apply increasing pressure to discover how much vertical space the pulse occupies. Combine this lateral palpation as you explore the depth to get a sense of where the pulse is strongest, both laterally and medially at different depths. The kinds of things you're looking for at this stage include taking the rate, how fast the pulse is, and the stability of the pulse. In other words, whether the rhythm and the sensation of the pulse hitting your finger remains consistent or whether they change. In the NCA clinic, because of the numbers of students, it may not be possible for you to take the pulse on both wrists simultaneously. You may have to take the pulse on one side while another student takes the pulse on the other side. If there is time, you can then swap over. You can still get a lot of valuable information from the pulse on one wrist. This process is good preparation for the next stage, which is learning to locate the 3 depths. This takes a lot of practice, and Dr. Shen says to learn how to read the pulse, you must first take 10,000 pulses. So this is the first step.